Hey, it's recording.
She says record.
Okay, today we're going to be learning about how to give an intramuscular injection. There's 4 usual sites that are used. One in the upper arm, known as the dorsal deltoid site. One in the buttock, which is known as the ventral gluteal site. Another in the dorsal gluteal site. And the last one is the vas lateral site, which is more formally known as the lateral aspect of the thigh. When you're giving the injection, you want to make sure you have all your supplies ready before you go. Always wash your hands first before you begin to prepare any meds. You also want to have your physician's order with you at the bedside to double check that you're given the right dose, right route, all that. Other things you will need, you're going to need a separate syringe in which you draw up your medication with, and then the actual injection needle that you will be using. Always wear gloves when giving the injection. You're going to clean the area that you're going to use for the injection site with alcohol. You want to allow the skin to completely dry before you inject it. For after, you want to have little gauze, something like a 2x2 with you to hold pressure in case there's any bleeding after, and a Band-Aid also. So you would start by explaining to the patient that you're going to be giving them an IM injection and what it's for pain or for whatever reason it might be. So if you're going to select the site, each site, the 4 that I described before, all have landmark areas that you use to go into the right place of the muscle. For the hip and the thigh area, most of them you use the trochanter, which is also better known as the hip bone. And you would place your palm of your hand over, and to give a ventral gluteal, you would make a V site where you would inject there. For the vas lateralis, you also use a V site with your palm of your hand over the trochanter facing down. Each of these muscle sites, you would taut the skin back tightly, and each of them you're going to go in at a direct 90-degree angle like a dart. You would hold the syringe like so and go in. Once you're in the muscular site, you're going to pull back on the plunger to check for any blood, because you want to make sure you're not in any major artery area or that you've caused any kind of damage. Okay, you can have a seat again. Okay, so we're going to demonstrate today on how to specifically use the deltoid muscle. This is most commonly used in flu shots and certain things you would get in a doctor's office. Your landmark that you use is your axilla line, mainly where your armpit, meets your upper arm.
Okay.
So using the axilla line, you're going to use that as your landmark, and you're going to go 2 finger breaths above that. So usually you can use your finger to maintain your landmark and use your other 2 fingers to go. And you should be in that muscular area there. So as I said before, you're going to wipe the area in a circular motion, never going over the same area twice. You're going to allow that to dry. They say you can damp the area off if needed, if it's too wet. After that, you have already had your medication prepared. So you have your syringe, you have drawn your medication up with the separate syringe, and then you have your injection needle. Typically the injection needle size is 21 gauge, and it is about a 1.5 inch long. You can change the needle size according to what size the patient is. Sometimes people have less muscle, so you would use a smaller gauge and a smaller inch needle. Usually those are available in most facilities. Again, you would explain to the patient, you would taut the skin back, you would go in like a dart in a direct 90-degree angle, you would pull back, you would hold the needle in place, pulling back on the plunger, checking for any blood, and then you would inject slowly. And then when you go to pull the needle out again, you taut the skin back and pull out. You want to make sure there's a sharps container at your side and use all precautions needed to prevent any further needle sticks. You have your 2x2s by your side. You will hold pressure to that area, making sure if there's any bleeding or anything lingering, most of the time you just place a Band-Aid over the area and tell the patient they can remove it in a little while. Explain to them that they might be sore. If it's a certain kind of medication, explain to them, try not to rub that area as the medication can be irritated. And that is how you give a intramuscular injection.